Glad to see all of you and really excited to get new updates from both the health department and community care licensing in terms of best practices for all of us and knowledge about what's going on in our county. Once Karina and Kimberly open the chat room, I'll be following it. So please listen carefully to the presentations. Feel free afterward to ask questions, to ask for clarification on a question. I'll be picking all that up and asking those questions and clarifications for you. We'll see how it goes, but the basic questions that most of you have already written in have been sent on. So I'm going to let the health department begin. I think they asked for priority here. So let's get started and see. I don't know, do you want me to ask the first questions? Is that easier?
That would be easier, yeah. Especially if we could start with the schools question.
Yeah, so question one, I categorized the questions with some depth to make it a little easier. But one question that came up first was, if a case, how many cases of COVID, active cases in a center, does it take before the county and county health might shut a center down? And so closure, when does it happen? And along with that, if a director or a teacher recognizes a case of COVID, who do they report to? So who do they report to? When is a center shut down? What steps does it take for that to happen?
Okay, well, I'll go ahead and start with that. Hello, everybody. My name is Michelle DiMaggio. I'm the Contra Costa Health Services Case and Contact Tracing Locations Unit manager. So good thing is you guys have been really good over this COVID time, and there has not been a reason to close a daycare. We provided guidance. We helped you through the process and helped you determine when the exposures to that point where you might consider closing a classroom or even multiple classrooms. So it's not really a number per se. It is, what does the exposure look like? Is it a student with multiple teachers, or is it just taking out one of the students and watching multiple teachers? So I guess it depends. It would be the best answer. And I hate to use that, but I never used it. I'm not a lawyer. So but it depends on the exposure within the classroom and multiple classrooms. If it's multiple classrooms and they're next to each other, shared space, then we might consider to advise you to close a daycare for that time period. And it's usually 10 days from the last day of exposure.
Okay, so if a case is found, who does a director report to?
Thank you. So there are two reporting possibilities. First, you can email, and then it's covid.business.tracing@cchealth.org, and I'll put that into the chat. Or you can go to our website, which I'll also put into the chat. We do have an intake form where you can just directly enter all the information, all the cases and contacts, and it'll go directly into our system. It'll be assigned to one of our investigators, and our investigators will call out to give you more guidance and probably ask more information. And I'll put that in the chat.
And Sherelle, did you have anything to add?
Thank you. Yes, thank you. I just wanted to make sure Michelle was finished with what she was stating. So so in addition to what Michelle has requested, as a director or as a provider, yes, you are required to notify community care licensing. And our reporting requirements first is you're going to give us a call as soon as you are made aware of your first case. And then we ask you to follow up on an unusual incident report. And if anyone has any questions about that report, you can always contact our main number, which is 510-622-2641. Anytime, Monday through Friday from 8 a.m. to 5 p.m.
Okay, good. So again, directors, if you have a case, contact both the health department and licensing.
Yes, and we want to add the fax number too. I apologize. The fax number for our office is 510, and we'll try to put that in the chat as well, 622-2641.
Okay, so
Thank
when the chat opens, Karina and Kim will make sure those contact numbers are there for all of you. The email is there for all of you. Thank you. So
Sure.
the second general question that I saw several times was travel. What are the county health recommendations for teachers returning from travel, families and children returning from travel, any quarantine required anymore?
Dr. Mercuria, I want to pick your brain on this one because I haven't seen anything recently. Have you? Or Christina
So-
Ponce?
Yeah, I can help.
Yes.
So
Hi.
travel depends on individuals' vaccination status. And currently there are just recommendations. There's no requirements based on if someone is vaccinated or not. And there's just some testing recommendations as well. So if people are fully vaccinated, and I guess it also depends on where they're traveling, depending on exposure. So domestic travel, if they're fully vaccinated, they just really monitor their symptoms, wear a mask. If they potentially had a lot of risk or exposures or potential risk for exposures, they may test 3 to 5 days after they come home. If they're not vaccinated, the CDC recommends for domestic travel that individuals get tested after returning from travel, 3 to 5 days, self-quarantine for 7 days, or self-quarantine for 10 days if they don't get tested. And then wear a mask and take other precautions. Again, this is just guidance and recommendations. There's no requirements based on travel. And so there's higher risk travel, whether people are flying or going international, which may warrant a quarantine period, but there's no required quarantine after travel.
Okay, so no required quarantine, but testing advised to make sure. teachers-
Testing. Test if they're, so per the CDC guidance, they are recommending if you're unvaccinated, so not fully vaccinated, to quarantine. But if individuals either way do quarantine or not quarantine, based on the recommendations, it is advised to test 3 to 5 days after travel for domestic and international travel for those who are unvaccinated, and for international travel for those who are vaccinated to get tested upon returning from international travel. And of course, to monitor themselves for symptoms.
Thank you. Thank you. All
Joan,
right.
do we have any school questions? Because I want to take advantage of our
Yes.
school managers that are here.
Okay, so one question, yeah.
Thank you.
Here they come. I'm trying to go in order here of what came in. And so there were questions about cohort groups and the number of children in a group with a single adult or with multiple adults. How many children can be together now? Do we follow regular licensing guidelines? Our partition, let's start with that and then I can. So how many children in a group, inside or outside?
So that was changed. It used to be 16 children and adults. Now there is no maximum number unless license certification might have something different. But it's basically keeping the safety precautions in place to prevent exposure. So continuing with the cleaning and then disinfecting when needed, monitoring for symptoms.
Okay, many centers put up plastic partitions or partitions at tables. Are they still needed?
That's a precaution that you can do. But again, the distancing was thrown out June 17th with the ETS standards, the Cal OSHA standards. And Sherelle, I don't know if you have anything different to that.
I'm gonna add to that. Sorry, my name's Loretta Dyson.
Oh, hi, Loretta.
Hi.
Look, Loretta, you're muted. Can we?
Sorry,
unmute?
we're having some issues. Can you
There we
guys
go.
hear me?
There we go.
Okay, I'm getting some feedback. So my name's Loretta Dice, and I'm one of the managers here, also in the Oakland Regional Child Care Office. Welcome, everybody. Sorry. So going back to the previous question as far as cohorts. So again, like Michelle said, there are no more cohorts. You guys go back to your regular normal ratio and capacity. So that for your infant center would be 1 to 4. For your preschool would be 1 to 12. If you have a toddler option, that would be 1 to 6. And for your school age, that would be 1 to 14. So you're going back to your normal ratio and staffing, and you're also going to adhere to the capacity. In regards to the barriers, like Michelle said, that could be an extra layer of protection, but it's not something that is required.
Okay. Along
Thank
that same guideline, there were recently K-12 guidelines put in place by Gavin Newsom, but nothing was said about preschool or childcare. So do those new guidelines apply to childcare centers, especially the ones who have school-age children?
Is that from
No,
Michelle? Okay.
okay, no, they do not, but if our school managers, since they're still on, if they want to add anything to that.
Kim, Karina, is there any way we can unmute Loretta and Sherelle and keep them that way? We're having trouble as they try to join in.
I'm here actually. If you want me to speak on that, I can speak on our portion.
Please.
Okay, so as far as we are concerned, when it comes to community care licensing, no, we don't have any guidelines that have changed. Gavin Newsom's, that information is solely for the schools. Nothing has changed for the centers.
Okay.
In
Can
family
I-
childcare homes.
I'll add one more thing, because we've just been getting a lot of questions. And so the school guidance and the school settings that has been released both by CDPH and Gavin Newsom is only specific through K through 12 settings. Even if there's a daycare on the school site or setting, they have to follow the different guidance and cannot do modified quarantine. And at this time, although we're reviewing CDPH guidance for shortened quarantine, and we will likely align with that soon, they can't shorten quarantine at this time until we update our quarantine guidance and quarantine order. So the daycare centers cannot follow the same guidance.
Okay. Okay. So there were several questions about testing of teachers, testing of, I guess, children. Nobody specified, but so the questions are testing, when to get tested, how often to get tested, and who should be tested.
And this is for K through 12
Or preschool.
or preschool.
Teachers in childcare at any level, or home care, early childhood settings.
For K through 12, the manager, I'm not sure if the managers, I know he's on Paul Young. I don't know if he's able to get off of mute.
I can, for K through
Okay.
12 settings, there is the mandate that went into effect, although it won't be effective till October 15th, about vaccination, which is different than the daycare settings, as you mentioned. But within that state health office order, unvaccinated teachers will need to be tested weekly, or they need to provide verification of vaccination. As mentioned, there hasn't been any similar order for daycare staffer settings, and there's no real requirements for testing or kind of a standardized testing for daycare providers. You can assume, particularly during a large surge and we're seeing an increase in cases and more community prevalence, that maybe testing for your staff members on some kind of cadence is, particularly if they're unvaccinated, may be helpful, maybe even at a weekly cadence, just to protect the children that you're seeing and also the staff members. But there's no requirements that state that. Additionally, of course, if anyone is symptomatic, even staff members who are fully vaccinated, you still would want to isolate them and test them as well.
Thank you, Dr. McCurry.
Okay. I hope that answers the question for those who wrote it in. Another question about functioning in the centers or in the home cares is, can materials and equipment be shared among children? And especially, I'm guessing, children from different classrooms or even within the classroom.
Okay, I'll start and then I'll see if Sherelle or I believe her colleague wants to add. Pretty much same precautions. They're real. I haven't seen any studies, and I don't know if Dr. McCurry or Sherelle have seen any studies, but it's still the cleaning. Make sure toys. Try to. I know with children, it's really hard to not share. Maybe they've gotten to that point where they don't share now, but try not to share. Cleaning toys after use. Washing those toys that are not washable. The same thing would go for mats, bed frames. So you're still doing, and especially after the children leave.
And I will add, and this can also help with the travel question, that you may not always know people travel, and the most important thing, similar as we're seeing in the school, is kind of the layers of protection. So to trying to encourage those who are eligible and can be vaccinated to get vaccinated, to do symptom screening of families and staff as they're coming to your site or facility, and to have those who can mask. I understand you guys are at daycare, so not the ages range, so not everyone will be masked, but those who can mask to also mask, and encourage families as you can, and if they're eligible, to be vaccinated as well, to protect their children and the kids that you serve.
Mm-hmm. If I can add to that, if you see, especially we mentioned the smaller children, if you see them playing with their toys or whatever it is in their mouth, again, trying not to share that toy, trying to keep it with that child, and cleaning as soon as possible.
Many of the centers during one or more of the last calls mentioned that they had baskets or bins in the classrooms where if a child used something, especially if they mouthed it, it would go into that bin and be out of sight for the rest of the day, or until it could be cleaned and put back on a shelf and in active use. And so that sounds like what you're saying is a procedure that should continue just for safety.
I saw that and I heard about that a lot. That was great for the daycares that I did see that.
Yeah, I thought so too. Really smart policy, and a way to do it, especially for little ones. So
Ms. Jones?
Yes.
Yes, I wanted to just chime in a little bit as well. So definitely we agree with what Michelle and I want to pronounce her name, but I don't want to say it wrong.
Dr. McCurry. Sophie. Yeah, Sophie.
Sophie had stated, yes, we are also just pretty much reminding staff to just be very mindful of the toys the children are using, because we still want to give them a normal play day. However, we have to be observant of what toys they're using, especially when they're putting them in their mouth. So they are doing a lot more sanitizing. And so we're just reminding them of that, and then try not to, piggyback off using the same toys as well. But same procedures, we're trying to keep it as normal as possible.
Good. Maybe once the presentations and some of the directors can share information on sanitizing and safety and the procedures they're using as an update for all of us.
And if I can add to that, for outside, again, the studies that I've read for materials, surfaces outside, the deterioration of the virus is still the same. It degrades pretty quickly out in the sun, out in the heat. So you're pretty safe on that. If toys are outdoors, keep them outdoors. If you can, try to wash down the playground, at least from what I last read was once a week, but because of Delta, and I haven't read anything specifically about the effects of Delta on surfaces yet, you might want to go back to maybe cleaning a little bit more, maybe twice a week on the outside. And again, that's just washing down. If you want to do the soap and water wash down, if it's going into sand, then that's probably the best.
If I may add to, so for us, community care licensing, we really require that they do it daily and then as often as possible. So we want to continue to keep that up.
Okay.
There it is. Thank you.
Sorry, and just chiming in. So just be mindful as well, the cleaning products that you're using, that they are safe for the children and that you're doing it where there's enough space and time in between so that, if there's a bleach smell or something like that, that you're doing it in an environment where it can be aired out, that it's not affecting the children or anything where they could sit down and kind of get a skin burn or something like that because of what's inside of the product. So just wanted to remind you guys of that. I think you guys are all doing, for the most part, everybody's doing well because we have not gotten that, but we did in the beginning, I think, kind of get a few things. So just keep that in mind as well. Thank you.
Good, good. Thank you for that. All right, another area where there were a number of questions had to do with masking and who should be masked, what regulations are in place now that should be followed for safety.
Okay, I guess we could all probably agree, everybody under 2 years old that obviously not masked, but everybody inside masked.
So from 2 and up,
2 and up.
everybody.
Yep.
And if adults are vaccinated,
I believe it stays the same now with the changes. Am I correct, Ellen C? Yep.
Yeah, and also in our county, we have, and actually think it's a Bay Area order, but there's a local health officer order that requires masking in indoor setting, public indoor settings. And so that would include daycare settings, schools. And so regardless of vaccination status. And so individuals should continue to mask. Of course, if they are too young or they can't for other reasons, there's some specific reasons within the order, then they don't have to mask, but other precautions should be taken. And we have our health officer order on our website as well.
okay. What about outside?
There's no requirements or for outdoor masking at this time, particularly because outdoors best, good ventilation. If you're having a lot of cases or a lot of concerns, some people can wear masks, particularly if you're doing like group activities and stuff while outdoors or not as socially distanced, which most kids aren't, but no requirements or recommendations at this time.
Okay.
And if I can add to, now that we're having the fires, you want to consider air conditioning during the day if you're going to be indoors. Because I don't know, some of the places that I went to, they may have opened the windows or opened the doors for ventilation. But now because of smoke, it'll be more difficult if they have masks in, and the smoke's really bad if they get closer to us.
Okay. Yeah, the smoke is another concern for sure. And especially with little ones outside and the amount of time outside in it. Yeah. Does licensing does licensing require any kind of parent signature or parent release to put masks on kids?
Okay, no, we don't. If you don't mind, Ms. Joan, I would like to go back just a little bit as well, just to discuss a little bit how community care licensing is enforcing the mask mandate. Because we cover 2 counties, we have Alameda County and Contra Costa County for our particular office. And then our other office has other counties, but we're talking, I think, solely about Contra Costa today, correct?
Correct.
And so Contra Costa, I do believe for the adults at the center should be wearing the mask inside and outside. As where Alameda is saying outside, it's kind of, determine if you want to or not type of deal. But we always still try to enforce the best practice as far as the health and safety. And so we do find that modeling the way, meaning if we want our children to wear these masks, that we should be wearing them as well. So that's pretty much how we're trying to sort of motivate our teachers and directors and providers to kind of model the way. Because right now, because of Delta, it is starting to spread like kind of wildfires. We get a lot of incident reports on the COVID. So we're kind of highly recommending it at this time that everyone, the adults, wear them inside and outside.
Is the county seeing more cases of Delta here? Is Contra Costa seeing cases of Delta variant?
Michelle, I may have to leave that one to you.
Well, I want to leave it to Dr. Mercuria.
Yeah, I will say not only Contra Costa County, but all of California and the Bay Area, the predominant variant that we're seeing is Delta variant. It's at least over 80% of what we're sequencing in the county and the Bay Area and the state. So most cases are currently Delta variant.
And cases in children?
I mean, I don't have an age breakdown in terms of the cases, and what we're sequencing, but in terms of general sequencing and the cases that we've been seeing, they have been Delta variant. And so taking that in consideration, I would assume cases in children are also Delta variant.
Wow.
Okay, and then Joan, I know you had another part of your question for us too.
Now I've lost it. I remember what it was. I've been thinking Delta variant in cases. Oh, parent signatures or parent consent at all?
Okay, no, we don't have any requirement for that at all.
Okay, but
Okay.
if I understand right, Contra Costa County is saying that all adults, and correct me if this is wrong, all adults, whether vaccinated or not, should be wearing masks inside and outside in group settings.
We just have our health officer order just indoors, but as mentioned, because of Delta variant, you could consider wearing mask outdoors in group settings, but it's not required in Contra Costa County, it's just indoors. And it's a
Okay.
choice to wear outdoors. But as Department of Social Services mentioned, sure, and adults to wear both outdoor mask indoors and outdoors for their facilities.
And especially with all the smoke in the air.
Right, and I'm going to also definitely, as Sophie said, I want to make sure that the directors here and the providers are hearing that it's not a requirement. So,
Okay.
so Department of Social Services, we're not saying that community care licensing, excuse me, but we want to make sure that, you know, we do want you to know that we recommend it because of the health and safety. So if someone decides not to, a parent sees a staff member not, we don't want it to be, it's like, oh, you have to have it. It's some of the centers are choosing to follow this guidance, even though it's not a requirement. And I don't want to confuse anyone about that. So that's kind of what's happening. So then we'll get the phone calls where it's like they're supposed to have it and they may not actually are required to. They're just doing it as an extra precaution.
Okay.
If I can add to that.
Sure.
One thing that, and I'm going to go back to the fires because we are in that season. I would recommend either having an extra mask, which you probably already do, or having parents bring extra masks. Because when the children are playing outside, that smoke is going to soak into their mask, and you don't want them to have to breathe in that all day. So if you have, it's called Air Now. Air Now is the state oh, I'll get that word for you in a minute, but good, bad, the ugly air. When it gets too bad and ugly, then you definitely want to monitor the children's masks.
And do air purifiers inside?
And just to add about the parents, because we are getting a lot of calls from providers saying that the parents are giving a lot of pushback. So unfortunately, it is the same as the other regulations that our facilities have to follow, that regardless of what the parents are asking, you know, you have to kind of follow those guidelines that are being put out for your facilities. But we always encourage communication because a lot of times that will kind of limit some of that pushback. Sometimes that will limit some of the complaints that we get from the public when there's a large amount of communication. And we do have our pins online too that are encouraging, you know, that have the most updated information for our providers. So we encourage you guys to post those maybe in your facility or to hand those out to the parents and let them know what licensing is requiring, what we're recommending. So that way that pushback kind of comes on, you know, for us that you guys are following our licensing requirements and our guidance.
Okay, that's a good idea to take the pins right off the computer and post them so that if a parent questions, you can say, I'm doing this because licensing is requiring it and I want to stay legal, I want to stay safe, I want to keep the kids healthy and follow the guidelines, and that may help directors. Okay, great. So the other big question is vaccination itself and whether or not center directors can require it. Can advise that their staffs, they're having, so directors are having difficulty. I mean, I can introduce this a little bit too. Hiring staff. There's a definite staff shortage right now of qualified people. They want to open up, they want to be fully available. for parents to be able to go back to work, but they can't find qualified teachers, and qualified teachers who are vaccinated may even be a little more difficult to find in some cases. So thoughts on requiring vaccination, or where are we now? Will the state finally include early childhood and childcare in terms of requiring vaccination? What do you think? Opinions welcome.
Ellen C, I'll leave that one to you.
I'm sorry, I was also trying to get off of mute there. I'm kind of struggling where my location is. Please forgive me with that for today. I want to first say this. Community care licensing is trying to work very, very closely with the California Department of Public Health, meaning we really trust that they have the education, they have the medical background, they have this information. So a lot of what we're giving, when I'm talking to the directors and providers right now, we really try to piggyback off of that. That being said, the vaccination part, we do not have any requirements for the vaccination at this time, but we just ask that you kind of keep your ear to the changes because they are probably coming. So right now, facilities are actually able to follow their own guidance when it comes to that. So that being said, everyone's not required to be vaccinated. I think for most of us, we think that is best, but that is still up for, I guess, discussion. They're still trying to decide that. So we have no information on that at this time.
And if you like, Joan, we do also have Christina Ponce. She is part of what we call our COST team, and she does provide vaccination education. So if you have any questions about vaccination, we've got great two people here, Dr. Mercuria and Christina on the line, if there's any specific questions regarding vaccinations.
Okay, that would be, yeah, nothing specific, except that, K-12 now, teachers are going to be required to be vaccinated as of October, or they'll have to test weekly. And so the questions are arising, what about in childcare? What makes it different?
Yeah, I'm not, we weren't, part of those discussions, so I'm not sure why things were included or weren't included at this time, but they, as mentioned, they could be continuing to having conversations and potentially add more, such as childcare staff. I just don't know, and there's been no updates in terms of that addition. I will say it sounds like staffing has been an issue, so it may be hard as an employer to require vaccination, but that is always an option for employers to do for their staff to require vaccination. Vaccination is another way to protect staff and the children that you serve. And although we are seeing more Delta variant, the vaccine is still very effective against the Delta variant. And even if people were to get infected with COVID-19, their infections are mild and there's less chance of having severe outcomes, but it is overall still very effective in preventing disease and particularly severe outcomes. And so something to encourage staff. But we have no real information in terms of the requirement for staff, and there's none at this time coming from the local public health, and I'm not sure about the state.
Okay, I know I've been reading in the paper about individual employers, companies requiring vaccination. I think that's a little tough in our field when you can't find teachers to begin
right with. That's what I was going to add in there. Yes, it's very hard for the directors and the facilities and providers to require the vaccinations at this time, because it will make it even harder to have staff, and you want to make sure we're maintaining our ratios. But what we were thinking is, we would probably recommend, they can recommend that they have the vaccination, but if they don't, maybe something to the effect of testing weekly. Because for places that don't have or meet that requirement yet, that everyone's vaccinated, they are at least making sure that they're testing weekly. So maybe that can be an incentive we will recommend to directors to help them with some of that staffing issues and concerns, is to have their staff just test on a regular basis. That may be something, we try to give solutions. That's the only thing we can really see at this time.
Yeah, and that is what this teacher, the higher education, the teacher one, it's having a vaccination and verifying you're vaccinated, or test weekly to try to capture any positive sooner. And I think another way we can think about the vaccination, I know it sounds very difficult to find staff in general, but it is protecting against severe disease. So less likely to be out for longer, less likely to be hospitalized, less likely to be needing higher level of care. So away from your staff and away from your agency for longer. So another way to kind of spin it if you're trying to talk to individuals.
Yeah.
I totally agree.
Go ahead, I'm sorry.
No, I was just saying, I totally agree with what she said. She's absolutely right. Yes.
And I know that, well, there was a question about for staff who do not wish to be vaccinated, that a center might require a weekly test and not pay for it. So, but the testing's free, so it's kind of a, I don't know, not a threat or not a help to go get vaccinated, because you can get a weekly test pretty easily if the school provides insurance and your insurance company. Kaiser, I know, will test you for free anytime you need it. So I'm sure Blue Cross or others will as well.
And we have our county sites as well that test for free.
Thank you, Sophie. Yeah.
Who
Don't
does?
forget if you
Our
use
county sites, we
Oh,
have
the
county
county?
sites throughout the county in both west, east, and central.
Okay.
And Dr. Mercuria, if they use antigen testing, does that go to the lab, or what should they do if they're doing testing every week using if, for example, using Binax?
Yeah, if you're using antigen testing, like Bionex, we do not recommend really home testing for these kind of surveillance or screening because can be issues of verification. It can be a good tool and other resource that people use at times. But if you have antigen testing or antigen testing is done, it kind of depends. If it's just done for surveillance and no symptoms or concerns, we kind of take the test as is. If there's no symptoms, there's kind of an algorithm that I don't necessarily need to go, unless you guys are using antigen testing. I imagine not many of you are. I'm going to say, yeah, but there is an algorithm that we kind of can go through if individuals are using antigen testing, like our Bionex now, but antigen testing is widely used by our school sites because they've been trained by the state to be an antigen tester, and also used in many of the healthcare facilities. And they're very good tests, particularly the Abbott Bionex now, but can have some, may need additional PCR tests depending on why it's being used.
Okay. Two other questions have just popped up here, having to do with draped shields. Any opinion on how effective they are? And the second question has to do with toothbrushing. Do either shields or toothbrushing make a difference in terms of holding off the virus or the Delta variant of the virus?
Okay, who wanted to start with? So shields are pretty good, but you still have to wear the mask underneath. I did receive a question regarding toothbrushing. The safest thing, because and then sorry, it's been many years since I've been myself in childcare.
Don't share toothbrushes.
Yeah, don't share
I
toothbrushes.
don't believe in that.
But if you're going to teach toothbrushing, try to maintain, of course, you keep your mask, keep the mask on, but also try to keep a distance while maintaining, because the child does at that point have their mouth open. So if you can maybe go off to the side or be at a distance, and I'm sure there's different ways to discover that. But again, distancing, even though it's not in the requirement, it's still a precaution, still a barrier.
Okay.
If I can chime in on that too, I would maybe we would recommend that in a case like that, when you have your cohorts, and we call it cohorts, but your ratios, we're maybe having one child at a time to go to the sink, go to the bathroom, to each child has their own separate time, versus when we have a line, we have 2 or 3 together, we would just say one at a time.
That's good. Thank you. I'll use that next time we go into it. Thank you.
But you're not saying that they cannot teach toothbrushing in centers as long as
Correct.
it's, yeah.
Correct.
Okay.
I don't know if this is even feasible, but if they're teaching toothbrushing, it might even be, if it's feasible to do kind of outside as well with more ventilation, of course, depending on smoke and other considerations, but really, because they are having their mouth open, they're kind of, and spacing as mentioned before, but kind of move if able to a more ventilated, like outdoor teaching.
Okay.
I didn't know you guys taught toothbrushing. That's cute.
They do. Lakeshore even sells a rack where toothbrushes are kept separate and covered. The 12 toothbrushes for the classroom. So I know that licensing has allowed an aide to take 1 or 2 children to the bathroom out of the classroom. Is that's still possible for an aide to supervise 1 or 2 children as headed to the bathroom?
Yes, that is still possible.
Loretta,
Sorry.
you're
Getting some feedback. Yes, that is still possible.
okay. So someone just sent that question in, asking about whether or not aides could supervise. And my understanding was 1 or 2 children can be taken by an aide now. So that's true. Another question that came in had to do with an aide supervising the classroom so the teacher can go to the bathroom. And that has not been okay. What about now with teacher shortages?
I apologize. Can you repeat that question, Ms. Jones?
So in the past, an aide could take a child to the bathroom with the teacher left with, say, the other 10 children or so in the classroom, but the reverse is not true. Can you, now with teacher shortages, is it possible for an aide to supervise a classroom of children so that a teacher can go to the bathroom?
Okay, so nothing has changed in that area. No, we're still going off of qualified staff as far as watching children. I may want to look up something just to clarify, because what I do find that when we start mentioning aide and teacher assistant, sometimes the misunderstanding on which one needs to have the units versus the ones that don't. So I want to make sure I answer as accurately as possible. So if you can just bear with me, I'm going to pull up our regulations on that. Do you mind if I just kind of go on and I'll come back to that?
Sure, that'd be
Okay.
fine. And then just
Perfect.
interrupt anywhere when you have what you need.
Okay, sounds good.
I
I'll be
know
right
what
back
those
with you.
guidelines are. Okay, so another question here that came from Kim is teachers may use draped, going back to the shields, which have more coverage and will allow the children to see the teachers' faces for language development. But what I just heard is a mask should be worn under the shield to be safe. Am I missing something here?
Yeah, unless the K through 12 guidance is released for the child due to developmental reasons that they could wear like a shield or draped thing, unless there's a reason, like a valid medical exemption, which there's not very many, teachers should continue to wear masks while indoors at this time per health officer order.
Okay.
And daycare providers.
Okay, so then I'm getting questions that are popping up on a variety of topics here. So we're kind of going back to normal discussion of, here we go on another topic. If teachers are tested, going back to testing, if a teacher is tested weekly because they are not vaccinated, do centers need to document that result?
I think because if you're testing weekly at this time, I think if given it's not required and no one is necessarily going to do auditing, you don't have to keep the results. Of course, if they're positive, you would have to report, or someone would have to report of a positive staff to us. But there's no requirements to test at this time, although it is a good thought with high community prevalence. So you don't necessarily need to keep track outside of your records.
Okay.
There is one thing I wanted to mention for developmental reasons in the K through 12 guidance. It did mention that teachers can have it off really briefly if you're teaching speech or for developmental reasons. And so this could potentially be done with a face shield very briefly with distancing, but I don't know how helpful that is. And then would need to return the mask back on ASAP. Is that what someone was asking before?
Yes, I think so. So if you were a preschool teacher and you held a story time and you kept this kids a short distance away from you, what I hear you saying is in that case, it would be okay to take the mask off and keep the shield on so that children can see your facial expressions and interact with a face.
I would say more, because story time can be a lot, it would have to be pretty brief if needed. Yeah, and we've had some instances where story time could, because it can be longer, even if spacing, it can lead to more exposure. So it'd be pretty brief. Like if trying to help whatever is needed for the developmental reason, but I wouldn't necessarily say for all of story time at this time. With
Okay, so how about parents entering the center? We have not allowed parents to enter at all. We've asked them to sign their children in at a door. How do you feel about parents visiting?
So that right there has actually, I'm going to say, kind of come back and bit us, because we do have a regulation as far as parents' rights, and they do have the right to go on the children's premises and see where their children are. What we were trying to follow, especially back in the earlier COVID-19 pandemic portion, we were trying to follow what CDC was saying as far as less communication, keeping your cohorts and all of that. But what we have found is they're still allowed to come in, but the facility can ask a parent to limit their time there and limit their location. So that way, especially if they're trying to observe their child, they can, but not be around other children. So we kind of consider to weigh that on a case-by-case basis. And so if we find that directors or providers are having that problem, we would probably ask that you give us a call and try to speak with your analyst so we can try to advise to that specific case or situation. Okay.
In general, for a parent to pick up a child, to walk in, take a look at the classroom, get their child and leave, that should be okay, especially if the parent is masked.
Yes, because again, we want to remind them about really the health and safety, right? And it's protecting their child just like everyone else's children. Because see, we also have the personal rights. And so we want to make sure that we're not crossing those boundaries as well. And sometimes parents, they don't understand that part, but we have to kind of be creative on how we kind of make them understand how it's best for your child as well as the other children.
So what about an outside teacher? Would you require testing or vaccination of someone who's coming in to teach computers or dance or an extra reading session or something like that?
We don't have any requirement at this time. I don't know if that's going to come in the future, but we have no requirement on that at all at this time.
Okay, so again, each director needs to decide best practices for that classroom, for their school. And
that is correct.
Whether it's worth it.
I would say whatever their guidelines are for their staff.
Yeah.
So
exactly.
they're asking those health questions before they enter. Have you been exposed? Are you having any symptoms? Making sure that they sanitize and they follow those guidelines too, as far as masking and everything. So at this point, that's kind of just where it is as far as adults, period, and coming into the facility, parents included. Have them follow those guidelines. You should be asking those questions to make sure anybody that's coming into the facility is coming in as, with as much information as possible. If they've had an exposure, if they're positive, if they've traveled, those basic questions.
Okay.
I think the confusion was for a while there, centers were not letting anybody in.
Exactly.
And so
Correct.
I think the difference now is you're saying they just follow the same rules and they can come in if necessary.
And for a while, that was the guidance, was to limit visitors. It was never a licensing requirement to stop parents from coming in, but that again, especially during the initial beginning of the COVID pandemic, that was definitely the recommendation, was to limit visitors from, and that was just in following CDC guidelines and the public health guidelines. But licensing, that regulation has never changed. Parents should always be allowed in a facility, because, and then you have a violation of the parents' rights if they're not allowed in the facility. So just having that communication with the parents that the regulation had not changed, but because of we're trying to mind the health and safety of the children, we are going to have to require certain things if you are to enter the facility. And you can talk to them about limiting again where they go, how long they stay at the facility, making sure that they're kind of just around their child and not exposed to the other children.
Okay, so two questions have popped up specifically related to licensing. So someone asked, my center offers a 5-day program, a 3-day-a-week program, and a 2-day-a-week program. They placed the 2-day-a-week program on hold to keep a stable group of children. How do you feel about them opening it up now?
That's totally for the facility to decide. The center, that's their decision.
Okay, so having a 2-day-a-week program in the same space that a 3-day-a-week program takes place, you know.
We're totally okay with that. We're totally
You're
fine with
okay
that.
with
If the facility, yes, if the facility wants to, yes.
Okay,
Make sure sanitation is being conducted and we're okay with that.
okay, good.
Mhm.
And then in terms of the aid and walking children, can an aide walk elementary school children from the elementary school to the childcare site for extended care?
Okay, so in our regulations, when you mention the word aid, an aide can take a child to the bathroom or watch napping children. And that normally it goes, they don't have any units. That's usually for a person or teacher that doesn't, I'm gonna call them a teacher. See, I wanna be careful. For a staff member that doesn't have any units. If a staff has units, like they have the ECE units, then those responsibilities does change. And so our regs, they're pretty specific, but what I find is the jargon we use, the wording, is where we get a little confused at. So an aide, to answer the question, an aide can only escort children to the bathroom and watch napping children.
Nap room. Okay,
Uh-huh.
so if you have 5 or 6 kindergartners, say, that are going to walk from the elementary school over, it should be someone with units
Correct,
that goes with them. Okay,
correct,
all right,
Yeah.
and that has not changed. Yeah,
correct. That has not changed, correct.
Sophie, do you want to add something here from?
Not to that, I just see a couple questions on quarantine in the chat and I wanted to address them before real fast because we've been getting these questions. Is that okay?
Sure.
Okay. So in terms, if there's a child who has a in classroom or K through 12 exposure and they're on modified setting or quarantine for their K through 12 setting, they actually shouldn't be attending after school programs and daycare, and they only should be, per their modified quarantine, and they're eligible for that, going to in-classroom instruction only, and then going home and otherwise within a quarantine. And so, and again, modified quarantine does, even if your daycare setting or your childcare setting is on a school campus, does not apply for your setting. Only if an individual has an exposure in a K through 12 supervised setting with mask on mask exposure, can they do modified quarantine for in-classroom, continue in classroom, and other things they need to do for modified quarantine, such as testing. The only other thing I saw in the chat that someone mentioned a teacher rotating among classrooms. In order to do that safely, if it's a music teacher, for example, music, they're singing and if they're able to do outside, that's more ideal, or more place of ventilation. But again, ensure there's a lot of distancing between the student or the children and the teacher, distancing between the other staff if they're rotating between different classrooms, and of course wearing masks for the teacher and those if it's an appropriate age group child in the setting, to have them wear masks as well, particularly if it's indoor. If it's outdoor and they're kind of doing that, I would still have the staff recommended to wear testing, particularly if they're singing, just because, infectious particles can be, if you're shouting or singing, kind of being the air more, particularly indoors. And so that's just something to consider. So if that individual was positive and they had good social distancing or doing other preventive measures, it's less likely to expose the children in multiple classrooms.
Okay. There's a question about safety of drinking fountains, that many centers closed them down. Okay to reopen them?
Cheryl, I don't know how you feel about this, but just as I'm environmental health before COVID, and I kind of know how spread occurs in other viruses and bacteria, and that's a surface that you're putting your mouth over or between. And I know I've read in CDC and CDPH that you could open it, but the concern is who's going to clean and sanitize after every use. So that's I don't know, Sherelle, or Dr. McCurry, if you want to add to that.
Does the doctor want to answer before I do? Because I definitely have comments. I don't know if you kind of see my eyes kind of cringe a little bit there, like,
I have no additions, but I do agree it can be challenging, particularly in settings with children and youth, to go clean it in maybe a congregating area. So there can be some challenges into opening it up right now.
Yeah.
But I don't know.
yeah, and I was going to just add to, our regulation says just to have it available. So to me, it would be very wise to have, pitchers of water with their own individual cups. That keeps a lot of the germs down. So I would agree with that as well. But we do not have a regulation saying that they cannot. We just highly recommend that they don't. That's as far as health and safety. As long as they have water available, that's what we want to hear. To have something for children to drink.
Okay, can one of you explain modified quarantine?
Yeah, I can explain it. And I see the chat, and I know it's frustrating that there's different regulations through K through 12 settings versus daycare settings, particularly when they're on the same campus. And we're just reviewing a lot of the evidence and reviewing kind of what from the state. And so at this time, I know it's frustrating that there is differences, but I'm happy to go through modified quarantine on a K through 12 setting. Classroom, or it can be outdoor on the bus. So if a student who is in a K through 12 supervised setting, so if they're on a field trip, if they're outdoors during school or in a classroom, if they have an exposure and they're unvaccinated or partially vaccinated, so they're not fully vaccinated, and the case is wearing a mask and the contact is wearing masks, so both mask on mask exposure, they could be eligible for modified quarantine as long as they're asymptomatic, so the contact. Modified quarantine means that they can continue going to their in-classroom instruction and go to and from class, but outside of that, they're essentially still should be at home. They shouldn't be going out into the community. They shouldn't be going to extracurricular activities. They shouldn't be attending sports. They shouldn't be any after-school programs, which would include daycare, and they need to test twice a week during the modified quarantine period. So it does take a little more monitoring on the school side to ensure that people are getting tested and that they continue to remain asymptomatic. And so that's what modified quarantine means. And that's what's currently taking place in the K through 12 setting for those that it's feasible for.
Well, I understand the frustration of someone who owns or runs an elementary level after school program. A child can be in school all day and not come for 3 hours till their parents pick them up into an after school program either on the same campus or nearby. Seems fairly ridiculous to me, honestly. But if the law has set it up that way, then, or the health department has set it up that way, then I think we should follow it and do the best we can to, again, keep the children safe and maybe in limited contact with different groups of children and different groups of adults. That would be the reasoning behind it to me.
Yeah. And the study.
Oh, sorry.
Oh, sorry. Go ahead, Paul.
Go ahead, Dr. McCurry.
Hi, Paul.
No, you go for it, Paul. You turned on your camera.
I was going to say everything Dr. McCurry has stated, and Joan, I understand the frustration. The state, the California Department of Public Health, issued this guidance for modified quarantine And that's based on data of other K through 12 schools in other parts of the country, that when students are appropriately masked consistently, that the risk of transmission from a masked student to another masked student is quite low. So I think they're looking at the risk benefit there. And as we probably know, in childcare, consistent masking appropriately is a little maybe different than in a K through 12 setting. So certainly we continue to look at the data and the evidence, and guidance may change. But currently right now, modified quarantine is only for K through 12 students who are asymptomatic and have an exposure when they're masked to a masked case during a supervised school setting.
So there's a question here, and I have one myself. Is there any information coming for vaccination for children under 12? Do we see that on the horizon?
What we've heard is potentially early or like midwinter. So maybe November, November, December, January is the thoughts right now, but we're still waiting to hear more information.
Okay, and boosters for adults will come by September.
Potentially, yeah. So the CDC did announce that they're looking into just general boosters for adults, potentially starting in September, as they're looking at data that maybe immunity may wane after 8 months, but they're still reviewing that. That they have recommended boosters for those who are severely immune compromised adults. And so that means people who are on cancer treatment, who may be taking immune suppressive, HIV, some things like that, like severely immune compromised, which has been started in the last week. But general population booster they're looking at, and they did announce potentially starting September 20th with that recommendation.
Okay.
Joan, can I ask a question real quick, because we're going to need to get off? Sorry, it's Loretta from licensing.
I'm looking
Was there
at
a
my
question
screen,
about
it's a
safe sleep?
different
Because we wanted
voice.
to
I
be
had
able to address
find
that
you.
if there was before we get
Sure.
off.
Loretta, sure. Go. Oh,
I'm sorry, was there a question about safe sleep on the questions that came in initially before the meeting?
on,
We wanted to address that if there was a question regarding safe sleep.
Oh, Joan, there were some specific questions for licensing. I don't know if you noticed, there was 2 different columns of questions. Maybe you didn't see those?
I didn't get a second
Okay.
column.
Tim, you
Okay, so
probably
I'll
have-
just speak on safe sleep.
Yes, please do, Loretta. Thank you for noticing. They got the questions for licensing, and maybe you didn't notice that there was a very definite list for licensing that you haven't gotten to.
No, I didn't get, I got
Okay,
one.
so I'll read the question and then I can answer that, okay?
Okay,
Thank you,
great.
Loretta.
So the question that we had was, can you explain about safe sleep plan and log for infants under 12 months? Okay, so in regards to the new safe sleep regulations, any child that is 12 months and under, there should be a safe sleep plan that is developed with the parents, and it's an individual infant sleep plan. And that is where you have a discussion with parents regarding the sleeping environment that they have at home, the child's ability to roll. You also speak about any information regarding, do they sleep with anyone at home? What do they normally have in their crib, and different things like that. So that plan is developed with the families when the child is enrolled. And that is form number LIC 9227 is the individual infant sleep plan. And that's where you develop that with the parents. In regards to log when the children are napping, that should be for any child 24 months and under. Okay, and that's going to be where you are checking the children every 15 minutes while they're asleep and documenting, that you have checked on them, who checked on them, were there any signs of distress at the time, or was the child okay when you did that check? So again, there's a section on our website, ccld.ca.gov, that's specifically for safe sleep. There is a frequently asked questions section on there. That would be good if you guys have additional questions, and then we'd also be happy to help if anyone had additional questions, either with your licensing program analyst, or you can call our main number for our office. Okay, thank you.
Okay, great. Thanks for that. Any other questions that
I think
specifically
most of
for
the
licensing that I
questions,
didn't get?
yes, I think you've actually touched on most of them. Maybe you didn't realize they were specifically in a column for licensing.
Yeah,
But I think you've asked a number of them already. But
If
Loretta
you
knew that
want,
one.
Joan. Oh, I apologize, Margaret. I don't mean to interrupt you there. I was a little delayed. I was going to say, I do have the list in front of me. I can kind of just maybe repeat and try to answer really quickly.
Okay.
The calls that were for the questions for community care licensing.
Thank you,
So the
Shra.
first one, I believe we have answered, but it says, are child care providers required to report if they have 1 or 2 COVID positive staff or children? And the answer to that is yes, they are. So the CDC explained their guidance, and then community care licensing, we explained our guidance. All right. The next one is what precautions will be mandated by CCL, and it says masks, etc. So we talked about the mask. We are recommending that the mask be used indoors as well as outdoor for adults, and for children, it's indoors. And I believe they had answered, CDC also answered that to their degree as well. And then the next one was, are there any documents or certification that need to be signed or completed regarding COVID-19? Pertaining to community care licensing, it is the unusual incident reporting form. And they also are required to call us first and then follow up on the form within 7 days. Okay. The other ones, any new regulations to be aware of since June? No, our answer to that is no, nothing's changed. Everything we discussed today is what we have, and pretty much it's been standard since what, probably last March or so. Any recommendations for when to close schools due to fire, smoke, which level of hazard? So as far as community care licensing, we have kind of touched on that too. We always just recommend that you analyze the situation on a day-to-day basis, because we don't really have a whole lot of regulations pertaining to fires ourselves, except for if it's something that is an immediate risk to the children, take precautions. For example, say there's fire or smoke in the air somewhere, and normally we would take children out for play. Well, maybe that day we don't go out for play. And as Michelle had stated, we may not want to have the windows open. We will use the AC. But again, if you ever have any questions or are unsure on how to proceed on anything, please always. Okay. Do we still maintain our cohorts? So as far as the old cohorts, they have changed. We're back to our ratios, which is our guidelines in our Title 22 regulations. And it says how to find staff that is willing to work. Now, unfortunately, we don't have a real big answer for that. We do hear about childcare careers, right? That's one that's really huge, but I'm sure CocoKids, you guys may be a little bit more help in that area, but that's all we kind of have over here, community care licensing. And then some of the colleges, I think maybe, I just kind of said that in my back ear there. Yeah, that's about it on that one. Sorry about that, everyone. Can you explain about the sleep plan? We just answered that one. And then how long should a facility close after COVID exposure? Well, we've discussed that as well. So I think we've covered at least the community care licensing questions, but please, we're trying to answer the ones that are in the chat. If I may kind of go back, I believe I did see one where they asked about the outdoor cleaning for the toys. Just kind of go scrolling back here. I believe here we both spoke on that, the CDHP as well as us. Our recommendation really is definitely as needed. So it could be daily, it could be hourly, pretty much as needed. If you see where a child has used a piece of equipment, to clean it up after they're finished with it before the next child uses it. I think there was some system about putting things in a basket or something. Outdoor equipment can be large, but if it's something small, they maybe can use that same idea, but pretty much just sanitizing is the key factor, sanitizing. Ms. Joan, Ms. Margaret, you let me know if there's any other questions or if I didn't answer something for you, okay?
I think you pretty much covered it. My apologies for not seeing a second page.
Joe, and I think we have such experienced speakers on the call that they're in the chat box answering faster than we could get to them. So
that
thank
we
you
can
all.
even-
Look at, they just all jump in there. Thank you so much.
Yeah, it's great. It's
We're here for you.
great. And Tim and I chat back and forth about what went wrong with me this morning. You guys are continuing on, which is terrific. So I know that there are concerns, and this is from me, with the Delta variant. Do any of you have any additional suggestions of how to move forward in terms of keeping the kids safe, getting the centers, clean and healthy? Anything new that's come up that you could share, or practices we should be aware of?
No, I think you guys are doing a lot of the work and doing a great job in terms of the different layers. Even though we're seeing Delta, none of our recommendations is really changing on how it best protects your staff and the children that you see, which includes masking when can. I see that question for developmentally children with
Developmentally,
if they're not able to wear masks, then for developmental reasons, then they can't wear a sheet, then you wouldn't necessarily review attendance for them, because that is a reason that they cannot wear a mask. But which includes, sorry, Matt, that was a side note, but includes masking, social distancing when appropriate, and also vaccination of those who can get vaccinated and are eligible within your setting. And so all these layers together, I think you guys have been doing it for a while and really sanitizing and cleaning. And so continue the great work.
Yeah, I agree with that. I've been in COVID response since July or so, July 2020. And you guys, I've been saying this all the time, all along, Margaret. I mean, you guys have been doing a really good job. Childcare has been doing a really good job. And the site visits I've done, you implemented multiple strategies. You're very careful. The kids are really good at the masking. Moving forward, because we're not sure, again, Delta's put us back probably to where we were in the beginning. Just consider what you did in the beginning. If you do need vaccination education for the parents, if you have parent group meetings where maybe you can put a large group together, give us a call. We might be able to help you out with that, to provide you with a vaccination educator. The other thing is spread the word. We still have child care providers that were not aware that they were supposed to report to the health department. And we have, luckily, our license and certification has said report to the health department.
Just to add to what you're saying too, Michelle, you're absolutely right. When they call our office and report to us, we always tell them to report to you guys as well.
That's exactly
We're the same
right.
players here.
They're like, license and certification told us that to call you. And please, yeah, spread the word, because there are child care providers still out there that are not reporting.
I could just add, I agree with everything everyone else stated, and it's been an exhausting, frustrating pandemic. We're all going to get through this together. There will be new information, and so it's really helpful that we collaborate and communicate, and families trust you with their children. So a lot of the challenges is about trusting information and having access to accurate information. So really appreciate everyone staying together. We'll hopefully get through this together quickly, as long as we can continue to communicate and collaborate. But there will be changes, and hopefully these changes are ways to make things better. But completely understand, it seems like the goalposts are moving constantly, but COVID has been that way. It hasn't been playing fair.
No.
So someone has just asked if there are posters or safety packs or flyers, anything that can be posted in a childcare center or a home to notify parents, either from licensing or from county health.
Yeah, we'll provide that to you via email, and I'll put it in the chat as well. But if I can go back, for providers, we do have an opportunity, Contra Costa Health Services. We do have a vaccine, can't think of the proper word, vaccination mobile van, I guess, Sophie, where if you have 5 or more people, and I'll see if I can find that link. If not, I'll email it to Margaret. If you have 5 or more people, they will go to the site to provide vaccinations, and you pretty much just register if you have more than 5 providers.
Okay, So
That's
essentially
very nice.
ask parents to sign up.
Yeah, that's a
Yeah.
good way to
Or,
get them there.
or your site as the daycare or childcare setting could sign up if you knew you had 5 like parents who were interested in getting vaccinated that day, or staff. And so it's just an online form that we have on our vaccine website. which I
Mhm.
can
Very nice.
Thank
Good
you,
for
Sophie.
people to know. Maria, I see your hand.
Yes, hi, I have a question. I mostly have older kids, but I have one infant. Can you explain for, I believe it's licensing, the sleep plan? If the baby started sleeping on the stomach, do I have to turn it back to the back? That part I didn't understand.
Yes, yes, you do. Yes, you would, excuse me. Yes, you would. So
But he is
that,
sleeping on the tummy at his house. And he wake up when I turn over and cry almost an hour.
okay, give me one moment. I'm gonna let another analyst, and we're getting some back feed. So let me let her chime in, okay?
Okay.
So hi, Maria. So that's where the individual sleep plan comes in. When you have that discussion with the parents, it would need to be documented. And there's a process that you would go through initially when the child comes into care. When you first accept a child, would be to put them on their back. And then if you observe them roll over, to again have them placed on their back. But then you have that discussion with the parents and document that they verified that the child does roll onto their stomach on their own at home as well. You have also observed that as well. And then that goes on the sleep plan. And so that way, when the child does roll on their tummy, you have that already in place, that is the normal development or the what the child does. And so that is where you have that documented, and that would be okay. Okay, from that point to have that child sleep on their tummy.
So Maria, what I'm hearing Loretta and Sherelle say is you need to have it documented. You need to have it in writing from the parent that the child does it at home, that you have observed it, and that the parent is okay with it. But if you have it in the child's file in writing, signed by the parent, then that's okay.
Oh, okay,
Okay.
perfect. It's my grandson, so it's kind of hard to do with licensing. He just started rolling over last week, and I make them to sign the note saying that
Yes.
they noticed, but they didn't know what to do about the sleeping time because he sleep
Yeah.
at home on the stomach.
Right.
Okay, perfect. Thank you.
So, and as a past director, a piece of advice from me to all of you that I got from someone when I started as in business, actually, not even being in childcare, was document, document, document. If you ever have a question about anything with any parent, with any child, date it, write it out, sign it, and keep it somewhere safe, because a year later, when an issue comes up, you won't remember. So put it in writing, put it in writing, put it in writing. It can never hurt, and it can help. All right, so also posted here for everyone, the mobile vaccination unit request. It just got put up on the chat. So those of you who think you might have some parents or staff, if the van came to you, might step up. Here's the information you need to email and get service.
So, Joan, we're going to need to start wrapping up, but I think I'm hearing from providers just by way of validating all the work they've been doing. You know, have you heard much about the research about transmission in childcare centers? They're doing such a good job. I would love for you to tell us that it's not as rampant in childcare as it is in other places. I guess that's what I'm looking for. Do you have any research that says, is childcare more susceptible, less susceptible, anything like that?
I usually try to keep my eye out for that. I haven't. I look at the CDC site and other public health sites. I haven't. Sherelle, license certification, Dr. McCurry or Paul, have you?
We don't have specific data, but on our website, we do try to track and post information about positives in our childcare facilities. So it is there to kind of indicate the information that we're getting. We can tell you that within the last 2 to 3 weeks, we have definitely been getting a lot more calls about positives in our facilities. Just in the last couple of weeks, especially since school has opened. We're getting a lot more unusual incident calls, a lot more complaints and things like that, but no specific numbers at this point. But that information is put out on the website as it kind of comes in, and we're able to look at the data as a whole, just in regards to positives. But thank you.
And that might be something that's helpful for everyone to be aware of, is that not when we do case investigation contact tracing, not only is it to stop transmission right then and there, but all that information is gathered and reviewed and can help shape future policies. So that's why it's so important for families, childcare owners to respond to case and contact investigation, because we're trying to get as much information as possible. And that can not only help that immediate case in the facility, but also help shape changes to future policy. So that's why it's kind of doubly beneficial. It's the immediate issue hopefully gets resolved, but also it helps the long-term picture as well. And maybe people don't always think about that when they're being called, trying to juggle a busy childcare and now a case investigator is trying to get information about the clients and what else might have happened. But that's also part of the reason why is it all gets funneled up to the state. That information also gets funneled to CDC to make everyone's lives hopefully better.
Thank you, Paul. I think you could see from Leah's comment that, you know, we really want to, I think so many times other places are getting closed down and childcare is not, because they're doing such a good job. And Michelle, you have been so good about saying they're doing a good job. So I just think we can't say it enough.
Yeah, what I'll do, Margaret, I think I've done this once before. CDC every so often will have a webinar. I'll send that to you. And when I find something that you might want to take a look at, I'll send that to you.
Thank you.
Okay.
And Kim and Karina do a great job of follow-up. We are recording this session because some people can't make it, and somebody like me might have to hear it a couple times. So I appreciate all your input. And Kim follows up with sending out all these websites and any other resources that you give us, Michelle. So even if you send them a week or two later, anybody that signed up for this webinar, they get all those resources.
Perfect.
Emailed to them. So I'm going to hold on to that. I think you volunteered to maybe do an educational session for parents, because when those vaccines come for 12 and under, parents are even more worried about their children than themselves. So they're going to have more questions before they move farther. So maybe CocoKids could help facilitate some of that.
Yeah, just let me know, and I'd be happy to work with LNC on that and put our team together for that.
That would be fabulous. And I personally want to say thank you to all of you for taking your time, the presenters for being here, and the directors for taking time out of their day, and the teachers for being online to learn more, to keep our children and families safe. I really appreciate it too.
I can also chime in. I want to make sure on behalf of our department that the directors out there, the providers out there know that we sincerely appreciate all their hard work, right? And that we're with them. And if they have concerns, please give our office a call. They're doing outstanding. We know how hard it is. We notice it, and we're working together, and we just want to continue to keep them motivated. Okay.
That's good to know.
Okay, we will leave the chat box open for a few minutes, but we want to thank everybody. Oh, Maria.
I have a question really quick. Anybody is checking on the schools, like health and safety? Because some of the kids they have been complaining that there is no soap in the bathroom, no toilet paper, kind of stuff. And we're in the Monte Diablo School District.
You can report that to, especially if it's restrooms or has to do with cafeteria or the kitchen, the food, you can report that to Contra Costa Environmental Health. That's CocoEH@cchealth.org.
Thank
I'll
you.
put that in the website, on the chat
Thank you.
here.
And if it hasn't already been done, I would recommend the first step is just to inform the school and the district if needed. It might just be a simple oversight, but yes.
Yeah, because when you get the, yeah, I agree with Paul, because when you get the inspectors involved, there's a whole process, report and all that. I have good inspectors.
We used to hear stories about no paper, no soap, but now there's no excuse. Now they really have.
They say they have hand sanitizer everywhere, but no for wash their hands and the toilet paper. And also I have one of the moms who have a high school child, and they say they don't let them close the bathroom when they go into the bathroom, and she hold 8 hours to go to the bathroom.
Ooh, ooh,
Terrible.
okay.
So, you know,
Thank you, Maria.
okay, bye.
So I want to thank all the speakers. I want to thank Joan. I'm so glad you could read and talk at the same time, Joan. And Kim and Karina for being our IT. They're answering questions that people are writing to them individually that we don't even know about. Everything goes on so beautifully. So thank you to Michelle. Thank you for your team that showed up. I really appreciate that. Sherelle and Loretta, thank you for your team that showed up.
Thank you for having us. Thank you. Yeah.
I don't know why it took us so long to get you all together. That helps our providers.
Right. Because all of these minds together, boy, we are going to be great.
Okay, you'll be hearing from us if we have another session. And thank you very much.
Thank you, everybody.
Bye,
Stay
everybody.
safe.
Thank you, everyone. Take care.
Thank you.
Thank you.